Radiology Rapid Review. So the way this is going to work is I'm going to present you with actual cases. I'll leave them up for about 30 seconds, let you review the imaging. After that, we'll go over the relevant findings. So without further ado, let's begin. So here's image 1 of 2. Here's image 2 of 2. Okay, going back to the first image. First thing that you'll kind of notice here is that we have an asymmetric soft tissue density right here. Looks to be a little bit superior to the right kidney. Unclear, might be some kind of adrenal pathology, maybe it's some kind of node. One history that I did leave out in this case intentionally is the fact that this case came in as a code trauma. So now we have this asymmetric soft tissue density here, looks superior to the right kidney in the setting of trauma. Now, it's always important to look in multiple planes. When you take a look at the image on the coronal image, now it's pretty clear this is actually the adrenal gland. If you go back to the axial, the left adrenal gland looks normal, thin leaflets, and now we have this soft tissue density in the right adrenal gland. Taking a look again on coronal, we have again this ovoid soft tissue density in the right adrenal gland. We don't have anything to compare to. Setting of trauma, definitely cannot overlook the fact that this may represent a unilateral adrenal hemorrhage, which happens actually more often than you think when it comes to traumas. Anytime you see a bilateral hemorrhage or bilateral pathologies in the adrenal glands, it's less likely to represent hemorrhage. However, when it's unilateral, soft tissue density in the region of the adrenal gland, in the setting of trauma especially, you have to question the fact that this might be an adrenal hemorrhage. All right, next case, image 1 of 2. Image 2 of 2, and this was actually taken 2 months prior to the first image. Okay, this next case, I show you a lateral radiograph of the right ankle. And what do we notice here first? First thing that you'll probably notice is that there's an area of osseous destruction here along the posterior superior aspect of the calcaneus. Also, what you notice is there's extensive soft tissue swelling, and it's most notably within the posterior aspect of the right lower extremity. There's also these ill-defined lucencies here within the posterior soft tissues. Now remember, this came with a second image. The reason why I showed you this image, I told you this was a radiograph taken just 2 months earlier. And as you can see, we don't happen to see any soft tissue swelling along the posterior aspect, and we don't see any evidence of osseous destruction. So now you know this was an acute process. So osseous destruction, acute process, we were lucky enough to have recent radiographs. First thought that should come to your mind is osteomyelitis. This happened to be a type 1 diabetic, poorly controlled, and he had osseous destruction, definitely pathognomonic and concerning for osteomyelitis. Now, what do you make of these lucencies here in the soft tissue? Lucencies in on radiographs should be suggestive of air. Why would there be air in the soft tissue? So this is highly concerning for necrotizing fasciitis. The mortality of untreated necrotizing fasciitis is high. So in this situation, when you see anything like this, osseous destruction, air in the soft tissues, necrotizing fasciitis, call the clinician, call general surgery, do what's best for the patient. All right, last and final case, image 1 of 1. All right, so now we're here at the bony windows, sagittal image, contrast enhanced CT, and the first thing that you'll probably notice is there is a horizontal fracture here along the T8 vertebral body, and in particular around the posterior elements. This patient I also intentionally left out is another case of trauma. So this actually happens to be the same patient that we saw in case 1. So basically, what is this? This is a chance fracture. This is classically known as like a lap belt fracture, and because it's a flexion distraction injury, what does that mean? That means that if you aren't wearing a shoulder harness, and let's say you're just wearing the lap portion of a seatbelt, you have the chance of actually flexing during an accident, and that flexing causes anterior wedging deformity here of the vertebral body, as well as a distraction element, which ends up leading to a horizontal fracture through the posterior elements. If we were happen to do an MRI or have MRI images of this patient, we would notice extensive soft tissue edema, as well as we'd be able to really assess the ligamentous portion of this injury. But this is known as a chance fracture. And oftentimes, chance fractures are associated with intra-abdominal pathology. This patient actually happened to have an adrenal hemorrhage, as well as this chance fracture. So I hope you enjoyed Radiology Rapid Review. Look out for more episodes, and until next time.